you. And then, so, oops.
Sure.
Yeah, after that, I'm gonna stop the sharing, and so you can start, sharing your slides. Okay.
Sridhar, one quick thing, you might want to enable the multi-present.
Hi, everybody. Good evening and welcome to the ISQAD 2022 panel session. And today we're going to be talking about VLSI technology in healthcare. As we all know, healthcare, especially during the pandemic, is becoming more and more important. And we are looking into different ways as to how we can monitor our health and control our health conditions in our day-to-day lives. And one of the important factors when we look into this domain is rather than going to the clinics or hospitals day to day, we want to be looking into more methods for monitoring and self-diagnosing personal wearable devices remotely. And that's something that we'll be talking about in our panel session today. So really, how do we use the externally worn devices to monitor, store, and transmit healthcare data for the betterment of society? My name is Siddha, and I'm joined by Tomi, who is our panel co-chair from Intel. And I'd like to introduce Alodeep, who is our moderator for today. Dr. Alodeep Sanyal is a computer scientist and is the co-founder and CEO of LifePlus, which is a company leading the path to the world's first ever non-invasive continuous glucose monitoring wearable solution. Alodeep is a semiconductor industry veteran and has played a leading role in developing the next generation server products for Intel before switching to his current stint at LifePlus. And with that, I'll invite Alodeep to the stage. And Alodeep, please take it over. Thank you.
Thank you, Siddha and Tomi, for introducing me and my esteemed panelist colleagues. I really appreciate the opportunity to share the stage with you all and lead today's launch session, which is the title topic is the overall challenges and solutions that we envision with the next generation wearables applied in healthcare. With me are my esteemed colleagues Ali Kabiri from Rockley Photonics, Avi Sarkar from Synopsys, Arindam Sanyal from Arizona State University, and Shintaro Izumi from Kobe University. I will introduce each of the panelists with their own brief bio when they present their own problem topic and share with you their thoughts on this general topic of wearables in healthcare. But I would start with a high-level introduction to the problem itself. There are multiple factors that are playing a very interesting role in defining the path for next generation health focused wearable products that we are either experiencing today or going to experience in the next 2 to 5 years. There are major demands toward the growth of this particular semiconductor product sector, especially as Siddha was pointing out, coming out of pandemic. Almost everyone in every country felt the need for further deeper remote monitoring of their general health on a daily basis, and to keep the health monitoring process simple as well as effective, cost effective, and almost like touch free, contact free, because any viral infection like what we all experienced over the last couple of years, like COVID, severely restricts us from coming to clinic and doing a full checkup and getting the medical advice and treatment as needed. So the demand for remotely monitoring the key biomarkers of millions of people at home is already on a steep rise and will be rising at a tremendous scale over the next few years. So the the cornerstones that we have been seeing on this particular space that that are driving the science and engineering challenge for this kind of products are as follows. There is a growing trend for learning deeper insights. For example, we all know that the wearable journey started with the fitness wearables, and I'm not naming any particular product name, but we all know that these first generation wearables were primarily focused on monitoring your fitness, your activity, and extrapolated way of measuring the calorie burn, etc. So that was the first generation. Then we started seeing fitness on top of that, some early biomarker tracking. For example, the key biomarker that was being very closely tracked by multiple devices in the market, very popular devices, were heart rate and heart rate variability among the first biomarkers. Then as the days progress and as we stand today, the demand for learning more about further deeper biomarkers to infer a better understanding of your body and if you are already suffering from any chronic disease or any infectious disease, the continuous tracking of the state of the disease can only be achieved through more deeper biomarkers such as blood glucose, blood pressure, oxygen saturation, respiration, other analytes such as lactate, different forms of protein, creatinine. So these type of deeper biomarkers are on the process of being tracked, and a lot more are on the path to come. So that's a global demand, and this global demand has been added by other demands such as the amount of data that is being generated by the wearable devices is humongous. If you want to transfer the sensor data itself through a communication channel, it could be Bluetooth, it could be Wi-Fi or 5G or 4G, whatever that is. If you want to transfer the entire sensor data from the edge device to a server or to cloud, the data bandwidth requirement is extremely high, as well as there is a potential for data leak and security breach and confidentiality risk and other factors. So more and more we are seeing a demand for analyzing the data on the edge device itself in a meaningful way, and many times this analysis will involve fairly intensive computing paradigms such as machine learning and artificial intelligence features, and that processing will happen on the edge device, and final processed output will go out of the edge device in an encrypted form to maintain the security. So that is a demand, an added demand. Then on top of that, most of these wearable devices are supposed to be worn most of the time of the day by a person. So it has to have a very sleek, user-friendly form factor. That should be light, that should be very easy to wear on and wear off, and very comfortable to wear for longer hours of the day. So that's an additional demand from the design and engineering perspective. Then on top of that, there is always a steep demand for longer battery life. Any device that we are using today, we always crave for more battery life, because no one wants to put the device on a charger and go for a downtime. So devices that are supposed to be body worn and supposed to be monitoring you 24/7, the demand for battery life is extremely high. Finally, and this is not the conclusive set of problems, but I'm just highlighting few of them, and my colleagues will get into deeper insight of all of these factors, as well as they will also add new angles to different problems as we continue the session. But on my introduction, the final topic that I wanted to touch on is most of the time this data is actually an individual's health data, and people are very frantic about keeping the health data close to their chest. It has a very high confidentiality demand. It has a very high security demand. So any data transmission over the communication channels have to attain a very high level of security. So that security requirement is high, and the IP, most of these innovative wearable devices house a lot of hardware IP that always have a risk of being kind of breached and stolen. So the IP protection is also a very high visible problem for the wearable industry. So with this introduction, I would like to switch the discussion to my colleague panelists. I would start with Ali Kabiri. He is a PhD, and he is right now a senior manager of technology product management at Rockley Photonics. Many of us have heard of Rockley, a leading player in the manufacturing of wearable biosensors. And prior to his stint at Rockley, Ali was a co-founder and biophotonics lead at Quantum Silicon Incorporate, where he worked on a fully integrated CMOS photonics chip for digital protein sequencing. Ali, would you like to take on the stage?
Thank you very much, Aladdin, for the introduction, and I'm very happy to join to this session and with my other colleagues. As Aladdin provided the background of how the market is trending right now, I can start like talking about some of the essential trade-offs. I mean, the life of engineers all with trade-offs. I mean, engineers live in solving trade-offs in different aspects. But what are the major trade-offs, or what are those that I want to mention here in design of healthcare wearables are those that are being pushed by the market, as Aladdin mentioned. So the market of healthcare wearables are changing now, and it started from the just fitness and health wellness measurements directing toward some medically graded devices that the users, the patients, and then the physicians want to know and monitor the customers or the users of this more accurately. So the major trade-offs comes with the position that as with number of biomarkers being increased in the domain and in the trend of the market trend, from heart rate, from respiration rates. Nowadays, people are thinking about having blood pressure, having their core body temperature, hydration, and then as we see, it's a lot of hypes on the glucose side, on blood alcohol concentration and levels, and lactates, ketones. All these are on the horizon, and then we see the like the biomarkers are critical, but the value and the grade that they're being requested are very, very critical. So this needs a lot of data processing, a lot of data generations, and then we need to create a lot of collecting a lot of data and also processing this and in a very fast pace. So, but at the other side, we know that creating more data, generating more data, processing more data, creating more heat. And then to release that heat, we need more space. However, the size of the variables are being set by the body. Like, I mean, when you have a wristband or you have an armband or you have a patch, this cannot be as big as you want. It's just like really constrained. So then we see that the size is here is critical, but at the other side, generating those and processing these needs more battery, but the battery cannot be extended because we're really tight in the space. So if you go to the next slide. Okay, so but what are the solutions to these trade-offs? There are different directions. I mean, not I would say this is inclusive, but at least I'm mentioning some of this. The first one is just doing the real-time data processing and try to bring all this AI processing, which done through some algorithm written in the software, move that all of them into the hardware. What it means that, as you see, like we have a microcontroller on the next generation. We have the FPGAs, and then now people try to design a chip, AI chips. The AI chips technically means that we're trying to add all those processes into algorithms, fit into the hardware. What it means that we're trying to or design a VLSI or advancing in the VLSI that we can run the algorithm at the hardware level as opposed to the software level. So other approaches in the real-time analysis is just like pushing the AI to the parameters of the system as opposed to only on the data. So, I mean, we are collecting a lot of raw data and then applying the AI into it. However, on the other side, instead of generating a lot of data and apply the AI on top of that, we can bring the AI back to the parameters of the system. And once we're collecting the data, so that would be more efficient. So this is on the processing side of it. So we can have on the integration side, I mean, there's two aspects. I will tell it quickly, but later on we can pack on more on that one. One side is just adding more components into the chip and then have the chip doing more functions, like bringing microcontrollers, adding all ASICs, and even other peripheries that we need for all packages in one chip. So this way, for one thing, we can improve the power efficiency. On the other side, we can make it the size smaller, so better heat handling and heat management. And on the other side, we can start to do packaging in a vertical way or in a lateral way by combining all the sources with the chips and with the PCBs in one stack up, as opposed to be everything on the side and disconnected. So and we also need advances in the battery. So for the battery, nowadays people think about like a freeform battery, distributed battery, just distributing the whole battery into different side of like the wearables. Not only just like a square rectangular shape on top of it, but just spread it as much as they can. This way we can have a larger area and fit it within every single part of the structure that we have. Plus, we need advances in the efficiency and I would say the battery life cycle in recharging the battery. That's what we needed, because people like to have wearables on them for at least 1 day, 2 days before they get a charge. They don't want to just have the charger always with them or lose out of the charging in the middle of practice. So I would say, if I want to conclude here, the VLSI advances can help in incorporating the AI. Plus, incorporating the AI, we can find a solution to address the market. Thank you very much. I'll leave the stage back to you, Ali.
Thank you, Ali, for connecting us to very pertinent issues of the current semiconductor and photonics related challenges for solving some of the very important problems in healthcare using this kind of wearable products and devices. So we will get back to some of these points later, but at least in the first phase of our conversation, we would like to invite the panelist colleagues to take on their own position on individual topics. So I would like to move forward with our next speaker, Avi Sarkar from Synopsys. Avi is a vice president of product management at Custom Design and Manufacturing Group at Synopsys. He is in charge of enabling Synopsys's modern open platforms for the analog and photonic design community. He is focusing on delivering significant productivity benefits for design, circuit simulation, and layout closure. Avi?
Thank you, Aradip, and again, hello, everyone. So, you've already heard from Aludip and Ali about some of the challenges that we will be talking about in the course of the rest of the panel discussion. So, if you take a step back, right, the medical devices for patient healthcare, they take many forms. Like we have the tiny ingestible ones, which are used for, say, in-body monitoring. You heard from Aludip and Ali about devices that you're wearing for monitoring your daily life activities, and or larger devices, right, which are for diagnosis and treatment machines. So the focus today obviously is more on the devices that are in the consumer market versus the clinical and the professional grade ones, right? Because the devices that are going into the consumer market, they are typically, given some of the needs that we have, are going to be very, very different from what we have traditionally used for, say, the hospital level application areas. Now, with these kind of devices, the overarching goal is to make it convenient, accessible, affordable, while keeping the treatment safer and also trustworthy, right? So some of the themes that you will hear from us on the security, as we collect the data, right? Do we compute it on the edge? How do we maintain the security and the privacy, compliant with all the HIPAA codes, everything? The second very important consideration that we see from our customers, right, as, for example, Ali and team and others, as they design these next generation applications, the quality of the data that we collect is in a very noisy environment. And how do you calibrate it? How do you trust it? How do you make decisions out of it? The second area is the devices are extremely small. Sometimes they're running, you heard about the batteries, for example. So low power is not just a necessity. It's a determining factor in terms of the design in many ways. And the third aspect is the long-term reliability, especially, right? How do we define some of the standards as the industry itself evolves? And how can we learn from other regulated fields, like, for example, automotive and other areas, as we create the next generation of these devices, either implanted or wearable from medical applications? So if you could move to the next slide, please, Aludip.
Sure.
Thank you. So what are we doing in this area from us, from our teams here at Synopsys? As some of you may know, Synopsys is the #1 EDA solutions provider in the world, but it's not that well known that we actually cover the entire spectrum from silicon manufacturing, silicon design, from IC design, providing the world's largest portfolio of IPs, all the way to software platforms as well. So this is where our applications are used by pretty much all leading software development companies in the world to make sure that their software, the apps that they're creating, are secure. And this is very important because the data that you're collecting from these sensors and these bio devices have to be treated as such. When it comes to designing these devices itself, the platforms that come in terms of whether you're designing an electronic system or a photonic system or a combined system. In many cases, when you talk about devices that are coming together, most of our customers, including Ali and T, are creating these on our platform so that they can combine the best of all the technologies we have. Low power, as I mentioned, it has to be the underlying theme of the design, but it cannot be only at the end stage where you measure it. It has to start from the architectural level, from the software definition, from the design of the system, all the way, and that in many ways drives the cooling, because sometimes we have seen some of our customers, they come up with some of these wearable devices, but the power is so much that it creates a thermal signature that you can't wear it in your hand anymore. Then what's the point of having that as a device? So these are things that you need to predict upfront and design for it. And then some of the IPs that you put in, are they satisfying the highest level of safety, quality, and reliability that you did? So as you, and many of you are working on these technologies, as you look to create this next generation of solutions, right? The sensors, the ADCs, the RF, the microcontrollers, all of these are key elements. Image and signal processing are also key elements. We talk about AI quite a bit, but this monitoring, the diagnosis, task, how do you enable it? How do you collect the data? And how do you make it in a low power footprint, in a cost sensitive manner, are the challenges that we are helping solve. So hopefully as we go through this panel today, we'll be answering some of these questions for you. Thank you.
Thank you, Avik, for touching again very pertinent set of points when you were talking about the thermal hotspot as one of the key challenges. I just recalled a couple of very costly product recalls actually because of the thermal challenges were not handled during the product design itself, and it actually relates to a company's reputation, business, cash flow, everything. So these are very interesting and critical challenges to tackle during the product design, and Synopsys, like other CAD, EDA companies are doing a tremendous job in simulating many of these effects at the design stage itself. So moving forward to our next speaker, Arindam is an assistant professor of Arizona State University. And Arindam's research focuses on how to localize a lot of computing on the edge device itself and how to make it efficient and as well as transmit the data in an efficient encrypted way. So I would like to invite Arindam to talk about some of these challenges that he focuses on.
Yeah, thanks, Aladeep. Hi, everyone. Good evening, and happy to share the stage with all of you. So in my position talk, I'll mostly focus on what is popularly called as data deluge in wearable sensors. So the wearable sensors individually, when they are used at home, if they're used continuously, they can collect a lot of data. So sending out all that data creates two primary challenges. One is transmission of all this data is energy expensive, and that limits battery life. So which is a fundamental challenge because we want all our wearables to run longer. And then transmission of data from say hundreds of thousands of wearables from many patients. So that itself would present a communication bottleneck. And this is a particular challenge for biomedical wearables in the sense that the information rate of these sensor signals are very low. They are sampled at a much higher rate. So these biomedical physiological signals are naturally sparse, meaning that they do not carry a lot of information all the time. So transmitting all the data does not make sense from both battery life perspective as well as the communication bottleneck it creates. And then there are associated challenges with collecting this data. Some of the challenges already are Avik and Aladeep has talked about. So for the application of these sensors would be for, say, monitoring patients outside of hospitals, so maybe at home. So a key challenge is the fidelity of signal acquisition. So there can be a lot of noise artifacts in daily life as the patient moves about his daily life. And then the other key challenge is how would AI models perform on this, say, lower quality data or data that already has a lot of noise artifacts. So how would AI models that are usually trained on, say, clinical data acquired from hospital, which are very, very clean, and they also have a lot of, maybe say, for an example, in an hospital, you can get a 12-lead ECG, but it's very hard to have a 12-lead ECG monitor connected to a patient and monitoring their ECG all the time at home. So then there's a challenge for AI models also as to how accurately they can perform when applied to wearables. And finally, there's also a challenge in the device design itself as to how these wearables can be designed so that it's comfortable for users to have these devices on for a longer time and can also allow higher fidelity or greater fidelity of signal data collection. So if you can go to the next slide.
Sure.
So some of the potential solutions would be to embed AI into the wearable itself. So that would serve two purposes. So the AI algorithm can itself act as a filter to determine which segments of or which windows of the sensor data has more information, or it can be used to extract key information from the sensor data and then only transmit those key information. So that reduces data transmission. So it reduces transmission energy, increases the battery life, and it also reduces the it mitigates the communication bottleneck. Now, this itself would bring a lot of challenges as to how AI circuits can be fitted into wearables. So traditionally, AI algorithms are computationally intensive, and fitting them onto embedded onto an wearable running from battery is not easy. So it would mean that we would need to somehow look for newer AI models or some co-design of the AI models and the circuits so as to optimize the energy performance of the circuits. And a way would be to perform fusion of sensor data and the patient medical records. So since these wearable, the data that is collected by these wearables, they might be of a lower fidelity, again, due to presence of noise artifacts. So some of the loss or some of the degradation in performance of the AI model itself can be mitigated to some extent by combining through fusion of the data collected from the sensor with the patient's medical records, such as their age, race, their demographics, comorbidities, and that can in turn be used to improve the accuracy of the AI models and then also personalize it for each patient. And of course, and this would also call for, on the material side or the device side, we'd also need to improve improve the fidelity of sensor signal acquisition. We'd also need new materials, maybe very high quality flexible, very ultra thin flexible materials that can stick better to the skin and reduce artifacts, and also be more comfortable for the patient to wear for longer term. So in summary, I say that there are a lot of challenges when challenges for application of AI in the wearable space, but there are also opportunities, and then there's a lot of opportunities to explore and a lot of avenues for research. So, thank you.
Thank you, Arindam. Your presentation was very pertinent, and there will be 2-3 points that I will revisit a little later, especially on the areas of the high grade of noise that is typically common from the body-worn wearable devices, and how to mitigate that challenge. And also the other aspect that I would like to discuss further with you is that how to basically how to filter this analog signal to make it higher fidelity, and how to calibrate these devices, the one that we're talking about, the EMR data. What would be an efficient way of bringing in the sensor data and the electronic medical record data together to better calibrate these systems and use the power of AI itself? So we'll come to these topics with further detail later half of the session. But for now, let me move to our final speaker, final panelist of the session, Shintaro Izumi. He's an associate professor of system for informatics at Kobe University, and he also sits on the board of directors of Osaka Heat Cool Incorporate. Professor Izumi's research focuses on the signal processing, communication protocols, security, and these aspects. Shintaro?
Okay, thank you for your introduction. My position and problems are mainly in system level. The first problem is trade-off between safety and usability. From the viewpoint of usability, small size, lightweight, and long lifetime are required. On the other hand, it is critical to ensure the safety of medical devices, including wearable sensors. So, for example, skin irritation is mainly caused by the friction between the device and human skin, or caused by the conductive gels. And there are concerns about low temperature burns due to device heat generation and battery expansion and explosions. And so small devices are required, but there is a risk of accidental ingestion. So we have experienced these events, really experienced these events in my field test, and time consuming to deal with them. So safety aspects are important, not only in mass production, but also in the evaluation of the prototype in the medical field. And my second problem is trade-off between simple operation and high functionality. So it is difficult for small wearable devices to have a rich user interface. So one reasonable solution is to use wireless communication to control it on a smartphone or in the server side. However, complex operations are not practical in a real environment because medical staffs and patients themselves will operate the devices. So a much simpler interface than the developer's estimation is needed, I think. In my experience, it is very hard to require medical staff or patients on duty, medical staffs on duty to operate devices periodically. Okay, could you move to the next slide?
Sure.
Okay, thank you. So, as a solution, there are various underlying technologies. I think machine learning and on-node processing, and energy harvesting are especially important. So one recent trend is explainable AI. In my experience, ethics reviews increasingly require clear explanations. As you know, ethics review is mandatory in experiments on human subjects, especially in medical field. So I believe that that accountability will become a requirement for both in software design and hardware design. And since because continuous measurement for long periods is often required, and long battery life by on-node processing is effective. Energy harvesting is also attracting attention as to be combined with on-node processing or any other low power solutions. There are some of the possible ways to extract energy from human activity, and these methods may be safe, but not so small. Efforts are underway to reduce the size, but basically there is a trade-off between the device volume and the power generation. So I hope these technologies will mitigate the trade-off, but I also believe they are not the perfect solution. In particular, it is necessary to consider the system level design, including interfaces. It is very important to facilitate on-site operation. But I think many developers lack this perspective. So it is my position. Thanks.
Thank you, Shintaro-san. So you laid upon a very important point in the end that uh, apart from all the technology and semiconductor engineering challenges that are connected with the design and implementation and rollout of advanced next generation healthcare wearables, it's also important that how this device is going to interact with the user, with the end user, and how because in many senses these devices will fall in a category which is not in the expectation of the traditional standard medical devices that the users and the healthcare providers and systems are used to operate. So because of that, how we manage the user expectation out of the use of these devices will also play a very important role. And I know that from my personal experience with our company's product design and development, that when we target end users as the consumers of this product, the user interface and managing the user expectation of how this device will perform and what output it will produce to the users is a very important aspect of the overall design itself. So thank you for touching upon on that very important point. So we got to the kind of the end of the first phase of this session. Our colleagues have all introduced very important pertinent problems in the context of design and implementation and rollout of next generation innovative healthcare wearables. I would like to take a pause at this moment and would like to invite questions from our audience. Any question from any of you?
There aren't any questions right now, Alodi, but to the audience, if you want to type in the questions in the Q&A button at the bottom, and then the panelists will be able to see the questions. Thank you.
Okay, so thank you, Siddha. If you or Tommy, any of you have any questions, please let us know, and then we will move to the kind of second phase of the discussion where I will be bringing on specific problems that in my mind are very critical problems to solve, and our colleagues will participate in a live discussion on those problems. So do any of you, either you or Tommy, has any questions?
Okay, thank you very much for asking. So I have one question. So in this kind of healthcare, the circuit design or device design. So as many panelists presented, basically, so we need to have the kind of a DAC or ADC. So it's a kind of analog circuit design. And usually, so in such kind of analog circuit is not scalable like a standard CMOS, or digital circuit design. And for the, circuit design volume wise and also power consumption wise, the usually the analog circuits you need to use the higher voltage. And then furthermore, the transistor size or dimension is also not so scaled down like standard CMOS technology. So that's why in the future, definitely the sensing circuit and monitor circuit need to use the analog circuit. So however, so that is not, the basic analog circuit doesn't have any good scalability. So which means, in the future, even though the CMOS standard process is getting the scale down, like the 5 nanometer, the 3 nanometers. So however, analog circuit itself is still the kind of the same range. And in that case, the let's say device design, die size wise and also power consumption wise, it's getting the kind of showstopper, I'm thinking. So do you guys have any comment on that question?
Good question, Tommy. Does any of you want to answer this question?
Yeah, hi, Tommy. I think I broadly agree with you that analog circuits, especially say if you're considering the front end analog circuit and the ADC immediately after the sensor, so they do not scale as well as the rest of the digital circuits. And I mean, these analog circuits would need at least like 16, 17 bits of precision, like rather than 100 dB of dynamic range. However, I mean, there is a lot of research in the ADC area, especially for the use of ring voltage control oscillators as the ADC core. So these kind of ADCs, they basically use digital inverters so they convert the voltage signal into a time domain signal. And then once it's converted into time domain, so the time domain quantization can be done with very, very fine step. And that just depends on the delay of the gate, which will reduce with technology scaling. So there are, and then the front end amplifier itself are also being designed using inverter-like circuits. So for this kind of circuits, the supply voltage can be low, less than 0.8. So there are some new VCO-based ADCs also, which can operate in like very deep subthreshold, like 0.3 volt. But at 0.3 volt, the dynamic range is not very high, but at 0.8 to 0.9 volts, this kind of ADC circuits can get greater than 100 dB dynamic range. And the front-end amplifier can also have a very high linearity. So these are not fully digital, but there is a lot of effort to make these circuits digital-like and scalable.
Thank you, Arindam. So this leads me to maybe have a little discussion on what do you guys envision as a standard kind of information flow through the hardware components for a typical wearable device, starting from the sensor itself that captures some analog signal all the way to the final output. So what are the components that you guys envision that should stay in such a standard data flow? What is your thoughts on that? Arindam, do you have any thought on what are the
So what I feel is that, I mean, after the sensor device itself, you would still need some amplifier circuit. So these sensor signals would be very small, right? Like hundreds of, maybe 10 millivolt or even hundreds of microvolts. So you would need some sort of amplification to bring them up to full scale or nearly rail to rail before the ADC can take over. So those would still be required. You would need what is very basic, a low noise amplifier, then an analog to digital converter at minimum. So once it's converted into digital signal, then you can do a lot of digital signal processing, some bandpass filtering to remove noise artifacts. And then probably what I feel is we would probably have some AI module on the sensor device itself for edge computing, which can identify maybe the key information. So do some information extraction from these sensor signals and then transmit those. So then it would go to the wireless transmitter side. So transmit that information out.
Right.
Yeah, if I want to add a little bit in here too, yeah, definitely. I guess the signal itself is pretty weak after passing through the body, and then just you get the scattered or reflected light back in, or the signal back in. you definitely need specific amplification. However, at the other side, I mean, other approach you can take in is improving your SNR by moving from LEDs to laser sources. So laser sources could be very narrow band on the wavelengths that you want, and then you can have like a tunability, or you can have multiple lasers being packed in the whole wearable that you have. That's one of the approaches that Rockley takes. So we're integrating a lot of laser sources in the one package. So then when you're swooping over every single laser, technically you are getting a better signal to noise ratio, and also every single laser could have a better intensity at the same time, as opposed to have like the LEDs coming in. So, but as Arina mentioned, so yeah, definitely we need to also add, after amplification, some filtration, some cleaning the signal, the noise from the signal. That's definitely needed, and all the variables at least have that one. Plus, I mean, denoising happening through the data processing. Nowadays, we see that many algorithm being developed to find a way to denoise the signal, because these noises are after a while, you see they have some patterns, and then AI algorithm could recognize that one, and then apply denoisation over that to improve the signal quality. So then you can do the better job in calling the biomarkers and knowing the actual signal that you're looking for.
That's a great point, Ali. So, do you also consider using other auxiliary sensors in the effort to eliminate some of the typical sources of noise? For example, the ones that come to my mind are motion noise, or even the sweat, that kind of sweat kind of noise. So, what do you think about? Uh, do you consider any other auxiliary sensor for canceling some of those noise factors, or what do you think?
I mean, in our platform, other sources of signal collections, like there are not only single detectors being used, there are multiple detectors are being used, and then these are being connected. So data collected from one and then the other one, all being are supposed to be correlated. So then using both channels, you definitely can improve your signal to noise ratio, because not necessarily all of them just receiving specifically same data set, because they have a different path to the body. However, they're talking about the same target, and that target is identical. So definitely they can improve your performance at the same time.
Thank you. Now the next,
So
yes,
maybe I'll just
yes.
this is a week. Maybe going back to what Ali was talking about. So Ali, as you look to use lasers versus LEDs, right? I think what's the level of power that you're looking at, right? Is power a consideration, an issue, or it's helping?
That's a great point. I mean, so definitely there are constraints on like how much power you can apply, but so I mean, what matters is just the intensity applied in the certain surface of the skin. So you can collimate the light and then use a lens to make the beam size bigger, even though it's still laser, it's coherent, and it has all benefits of the laser, but it's not really pointing in a small area. So you can increase the size, and by increasing the size, so you really reduce the burning issues or anything, and then you have to be controlled, and you have to take the quality insurance over that to make sure that you don't create any damage to the patient, because these are critical. So then you have to pass certain regulations to make sure this is right.
No, thank you for sharing that.
So, Sita, you have a question. Could you ask that question yourself?
Yeah. So, given that we've been discussing a lot on how do we integrate these technologies, and at the same time, as a consumer of this technology, how do we become more and more open to using and applying wearable devices in our day-to-day lives? I think that brings up some questions around what are some privacy preserving AI-based methods or data collection methods or data processing methods that can be used to make sense, first of all, of the collective data that is being collected, but also what are some trends that can be identified from that collective data that can eventually help us as a society understand healthcare better and move hopefully in the right direction.
So I think that's Anudeep, if you don't mind, maybe I'll take this
Absolutely.
question. Yeah, this is a very interesting question because, and Siddha, you talked about COVID and the pandemic, right? One of the very interesting measures, I would say, in terms of biometrics or early indicators was there was this company that was measuring temperature, right? They had this thermometer that was connected to the cloud, and it would anonymize the data that was being collected and roll it up. And if you go back to early 2020, when the pandemic first hit us, every store shelf was out of thermometers. Everybody wanted to measure the temperature. And this particular company rolled it out in which they were collecting the data, rolling. And the heat map that they were generating across North America became early indicators of where the next COVID wave will actually hit us. Because it was becoming very apparent that as the sections of the population became ill, right, or they started to show the fever, they would come down with COVID. So I think the message is that, but it was entirely anonymized, right? So everybody was fully on board, at least some of us who were using it, to sharing the data because we knew that it was not necessarily going to come back saying that, okay, this particular household is infected or not. But the value of the data, and I remember that many of the healthcare bodies at that time were using this data to direct a lot of their reaction and the treatment policies as well. So I think there is value to having this data in a way, even if it's anonymized and aggregated to drive broader healthcare policies.
Thank you, Avik. I wasn't aware of this particular example that you mentioned, but I do want to bring up another example that I think is quite common. And it references the Google flu study, and I think this is a pretty common example that we study a lot in machine learning and AI, where, Google started predicting flu trends based on how people are searching for flu symptoms when they just do a normal Google search, right? But there's a difference between correlation and causation, especially now that you know that this is being counted somewhere. People may just try to add entries, even though that doesn't actually relate to something that's happening. So there has to be some kind of a filtration technique that identifies if this is something that actually relates to a true event happening versus, is it just kind of a data point that isn't associated with a true event.
It's true.
So thank you, Siddha and Avik, for bringing up this topic. So one related aspect of very practical aspect of doing a lot of processing on the edge itself, including the ML and AI processing, is a memory requirement. And what I noticed personally from my own experience is that in the commercial scale, as the industry stands today, I do not see a good kind of processor SoC fabric that comes with the adequate memory, that would really help us with the scaled kind of local edge processing of the ML workload, the inference workload on the edge itself. So, what do you guys think the would be the industry roadmap, and what could be some of the challenges on bringing more memory to the processing fabric itself?
Alan, if you don't mind, I can take a little bit here. That's totally true. I mean, the data generation is massive. Like, I mean, we see that if you want to measure body temperature or hydration, we have to collect a lot of data and train the algorithm. And if it's going to glucose, I mean, you already have that in your system. So it would be even more data needs to be collected. And then ML has to work on top of that to do the processing. And that would be a challenge. I mean, first, it takes a lot of time, and it also needs a lot of power from the chips or like the microcontrollers to do that. So there are trends right now, two directions in the industry. One of them is I guess recently many papers just came out on that one, that they're trying to move the AI algorithm or AI from the raw data generated to the parameters of the system. So I can give an example on imaging systems that when you have an MRI or you have CT scans or something, some sort of like devices like that generating the image. So you see that how much of a signal being collected to rendered and to create that image. But at the end, something has to be detected here. And then that AI comes to play to detect that one. But nowadays, like the technique is going to optimizing the parameters of the systems. What I mean by the parameters of the systems, like all the knobs that is being set for the system, which changing the driving the whole data collections from the sensor itself, from the hardware itself, and then being trained, and then optimized for making a device that once the data is collected so rapidly, you can call the image or call any issue in that image, and that's become a trend. And even though it's started recently, maybe in a couple of years ago, but I think this would be one of the methods that could help in that direction.
Got it. Makes sense. So one of the question that Siddha again asked, and it's a very pertinent question, that so when it comes to the memory requirement for the kind of advanced breakthrough wearable ML AI based devices, what kind of memory requirement that comes to our mind? Is it it's a tens of kilobytes of SRAM, or several gigabytes of DRAM, or tens of gigabytes of non-volatile memory? So what kind of memory requirements that come to all of our mind? I do have an answer, but I wanted to first go through you guys before I give my personal answer on that.
Yes. Okay. I think 10 kilobit SRAM is required. Of course, when the wireless communication is reliable. But I think, unfortunately, now wireless communication is not reliable. So now in my experiment, we use several gigabyte flash memory, unfortunately, because wireless communication is not reliable. But in my opinion, to reduce the power consumption in the system level, several kilobyte SRAM is minimum solution. I think so.
Thank you. Thank you. Any other take on this? By the way, I mistakenly said it. The question was from Siddha. The question is actually from Tommy. So, any other take on the memory requirement from a practical standpoint? I think my personal take is we are beyond the kilobytes of memory requirement, Shintaro-san. I think we should be the more practical solution should be having at least like of the orders of few tens of megabytes of SRAM. If you really want to handle the ML workload on the edge devices, you need in the megabytes. And my gut feel is you need at least like 50 to 100 megabytes of combined memory. And more memory you get to the closer to the processing fabric, the ALU is better, because then otherwise latency becomes a problem itself. So the next point is, so there is a question from Cart, who is one of the audience on this session. He says that he had to wear a heart monitor for 2 weeks. It was big and bulky, uncomfortable, difficult to remove. He expects that in near future there should be devices which should be worn for longer time, will use energy harvesting solutions. So his question to the panelists are, how far are we from these energy harvesting kind of solutions?
Yeah, maybe I can, this is a week, I can start first. I think Arindam talked about this earlier, right? I think when we go, I think it's the combination of the application and the type of circuits that you're using. The application drives what architecture, what kind of signal to noise ratio, and all of that it support. And then that essentially then drives what you're using for the devices. And then if you have to operate at 0.8 volt versus 0.3 volts, that again determines what kind of battery size. And Kurt, not knowing what kind of monitoring that you were using, I had a relative who was using, for example, LVAD kind of a device that had a significant power requirement. So that is obviously out of scope for, say, energy harvesting, which is still very much limited to very, very small applications, even for pacemakers, for example. Pacemakers today still rely on battery sources largely. We don't really have a path to see energy harvesting. They are still, I would say, very, very limited, given that the devices that are being used, the technology that is being employed, the technology that's being employed there is a compatibility gap between what are we employing these devices, how much energy they are using, versus how much energy can the energy harvesting process itself can generate. And until these two converge, I think we will still not see that happen. I don't know if I lost the audio here. Arindam, or if you had any thoughts on that?
No, I think I agree with you. This is again very much would be a function of the application. But so far, I mean, in academia, I mean, we have, so there's a lot of interest and I mean, building this energy harvesting wearables. But I think so far what we have, I mean, most of these works that claim energy harvesting, I mean, all they would demonstrate would be a very simple, maybe operating a single amplifier that can capture ECG signal. But definitely, like if you have to put readout circuit, then digital signal processing for denoising, transmitter, all of those are still very difficult to run from energy harvesting. So if say, I mean, the sources of energy harvesting are typically like one of the common sources is RF, and then another would be say body movement, piezoelectricity, but they would all generate probably like a few microwatts of power at most. So having a full system running, wearable system running on that kind of power budget is, I feel it's still not possible right now.
Sounds good. Sounds good. So I would like to now, we are about kind of 15 minutes away from closing the session. So so far we have covered quite a few very interesting topics and great input from all the panelist colleagues. I really appreciate. The other topic I wanted to touch is more on the data and the IP security side of it. That since we are dealing with devices that are supposed to contain kind of medical data from end users. We know, in most of the countries, this data has been considered very highly confidential and highly kind of individual-owned data that need to be kept in, transmitted in a very secure way. So, what are the common approaches that we see that has been taken for this type of wearable devices when it comes to transmitting the health data from the edge device to the cloud? Any take on that? Do you guys hear me, by the way?
Yeah, we can hear you. I think, yeah. So I think, there are certain standards that are in terms of security requirements, right, for the applications. And when we create some of these and we deliver them, we have to comply to that. And I think this is where one of the trends that we see, especially for many of our customers who are creating these, the next layer of the stack, right, the applications or the firmware, and how do you make it secure enough? And it's not just security from the point of the data transmission and all. The software, is it written with security first in mind? The IPs that are going in, are they created with security in mind, with certain amount of handshake protocols that are being enforced? So we do see that increased attention now from many of the, from going from the architecture phase itself. As they're designing it, this is becoming more and more critical. And some of the solutions that we have been putting in, just based on the demand of that, I think it's taking off. It's not, I wouldn't necessarily say that it's fully baked in.
Got it. Yeah, I also strongly feel that it is a relatively nascent topic and has been evolving as we speak, and lot more more standardization is about to come on this space. But having said that, it is very important that when we are transmitting the medical data from these edge devices to the hosting site, it has to be, the security aspect has to be taken very high consideration. I think there is a question that Tomi has been asking, that what kind of new sensing monitoring would be available and projected expected in the space. Do we have enough already, or are there any new interesting trend and sensing devices have been on the process of being developed?
Again, just to kick it off here, and I'll let Ali talk about it. When we see our customers create the innovation that they are driving, I think we are at a very, very early stage of what's possible. The application of many of these technologies, let's say photonics from Ali and team, for example, or a lot of the innovation, like we are hearing of people creating, let's say we talk about pacemakers, for example. They are limited by the battery, but could you use the flow of blood in the heart as kind of an hydroelectric force to drive and sustain that pacemaker longer term in some kind of an energy harvesting manner, or real-time monitoring of multiple different biomarkers all through the body. So I think we are at a very early stage, And not just these, right, in terms of wearables or ingestibles. Using MRI data and all, can you use AI applications, for example, to predict early forms of malignancy? There is research that's saying that, say, liver MRIs are able to detect to almost 95% using some ML techniques of a likelihood of a patient developing a malignancy down the road. So I think we are at a very early stage in which a lot of these fields are intersecting. So it's definitely a very exciting time for this industry.
Yeah, I intend to agree with that one too. So we're really in the early stage, and I mean, we see there are a lot of companies now moving in the directions of collecting a lot of data from the users, from the patients. And as we see the trend in the market, not only they're trying to collect and get the data from different biomarkers, at the same time they're trying to do it at the medical level accuracy. And what we get there, so we can see by the accumulation of more data, more samples from patients, and monitored like continuously, we are getting to the point that many new I guess scores, indices will be generated. And I guess people don't really like here to when they have like a wearables or like a wristband or something, just tell them, okay, so go and walk, or you're getting you're seated a lot or something like that. People will start to looking for more complicated or more personalized score, or I would say report for themselves. So the invention of expert systems that talking to them with more accuracy on what's going to happen with them, and then what the risk they are at right now at this moment, as opposed to tell them do what, for example, eat healthy food. This has become very critical, and then we cannot get there until except we get a lot of data in a very clinically accuracy, and use AI systems to correlate this with the disease that people over time create or get. So I think, yeah, you're right. So we're really at the beginning of it. And after this pandemic, people see that not only they're just want to know about their health, but they want to know predictions. They want to know what's happened in the future, and then how they can start stopping like things going to happen with them. And this never happened without collecting a lot of data in a very concurrent and very live manner, and also processing it with the AI system.
So that's a great point, and that also leads me to the very final topic. I wanted to lay a seed on this panel session among the panelists as well as the audience, and is that like automobile and many other industries where semiconductor has really done accelerated revolution, healthcare is also a highly regulated industry. So what I, again from my personal experience, but I've been noticing, and I have a deep feel that on this space, starting from the component manufacturers to more on the higher up on the layer of abstraction, every semiconductor player will have to play their own part on basically doing the proper certifications like ISO 14985 and other certifications that are needed to support the final product on their regulatory journey, on their regulatory path. It could be FDA, it could be CE, MDR, or other related medical regulatory agencies. But I feel there is a lot of work still pending, and a lot of kind of standardization has to happen, starting from the software, to software vendors, to component vendors, to more like a board, and even at a system level, everyone has to gear up and take ownership of their own pieces of the solution to get certified through the proper regulatory body so that the end product gets closer and closer to therapeutic medical use. We are not there yet, and I do see a major need for the growing awareness on that space. As soon as the individual players, the stakeholders can become aware about their own role in doing the necessary certifications, we ultimately get closer and closer to attaining medical grade fidelity for the end product. So I think we are at a good point. We covered quite a few very interesting topics, and I sincerely hope that our audience were able to connect to the real problems of this very interesting new era of coming up with medical devices and semiconductor products and devices in the space of healthcare. And I think I personally, I'm a big bullish supporter of this type of products, doing tremendous job in the daily monitoring and therapeutic management and improved compliance and adherence for the patient population. A lot more are yet to come on this space, but this was an interesting session in touching up on some of the very critical aspects of the problems that we as a varied group of industry colleagues have been dealing with on our day jobs on our daily basis, and we have been trying to keep ourselves very sincere and honest on solving some of these problems. So any last questions that the audience could have on this topic? If not, I would like to ask my panelists if any of you have a final word on your take on this particular question and on this particular topic or any allied topic that you wanted to share before we make a close of this session. So maybe share back the slide deck for 1 second, and that way we conclude our session today. So we wanted to thank you, ISQED, the organizers, for giving myself and my colleagues Ali Kabiri of Rockley Photonics, Avi Sarkar from Synopsys, Arindam Sanyal from Arizona State University, and Shintaro Izumi from Kobe University, Japan, an opportunity to come and speak in front of you on the core challenges and problems of delivering very high quality advanced medical grade wearable products focusing on key healthcare problems. Thank you very much for giving us this opportunity, and I would like to thank my colleagues as well for their very valued input on most of these critical challenges and potential solutions. It was a great learning opportunity for me. I thank you very much. Thank you, everyone.
Thank you.
Yeah, thank you very much,
Thank
everybody.
you. Bye-bye.
Thank you. Have a good day.
Bye, everyone.
Thank you, everybody.
Thank you.
Thank you.